So let me start. Can I say good day, everyone? And a very, very warm welcome to you all to today's webinar. My name is Victoria Njunu, and I am the Regional Director for East and Southern Africa at Health Logistics, which is the program of the Kuna Foundation. Thank you so much for joining us today from across the region and beyond. We truly appreciate it. We know that your time is precious, and we are very, very grateful that you're here because this session isn't just another meeting. It is a springboard for system-wide change. I think we're all wondering why we're here, and we're here to explore how the humanitarian system works, and just as importantly, to ask who holds the power within it. Today, in this webinar, we will be launching a policy brief that connects the insights from our recent thought leadership workshop, which was held in Nairobi in June this year. And the intention was to work towards action, towards influence, and towards change. So this isn't just about what we talked about. This is about what we do next. Who are we? At Health Logistics, we are very, very committed to improving the effectiveness and efficiency of humanitarian supply chains, which are critical for humanitarian response. And in doing it in a way that puts local leadership at the center. So our thought leadership initiative, and the first one that we did in June, is one of the ways in which we do that. It helps us translate field experience into practical policy influence. This is not a one-time event. In fact, it is a continuous process that involves interviews, rigorous analysis, collaborative workshops, and more importantly, the local voices that participate in this ecosystem. So together, we are building a community of practice and a space for humanitarian change makers to learn, connect, and lead. During that first workshop, we tackled some hard but very necessary questions. We talked openly about power dynamics, accountability, relationships, and decision-making. And from those conversations, we identified 7 priority actions, 3 critical challenges, and 4 key stakeholder groups that are essential to driving change. That is why we are launching today, and that is what this brief captures. So over the next 1 hour or less, we will revisit those key insights. We will explore how they can influence real change in policy, partnerships, and programs. You will hear from people who helped shape the process and from several respected thought leaders in East Africa. We hope that the session will be engaging, thought-provoking, and relevant to the work you are currently doing. I know, and we all know, that creating change in this space takes courage. Courage to ask difficult questions, courage to work together across sectors, and courage to imagine something better. And I would like to quote someone who I get and I understand, Margaret Mead. She puts it perfectly well, and I think it fits perfectly in this conversation. Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. And for me, that is what I carry when I have this conversation with local actors, local leadership, and how we can change the humanitarian system. So as we begin, I invite you to bring your curiosity, your experience, and your voice into this conversation. So let's keep challenging assumptions, let's strengthen collaboration, and let's ensure that local leaders aren't just heard, but are actually leading. Thank you once again for being here. And with that, let's get started. Thank you.
Thanks a lot, Vicky. Good afternoon, everyone, and thank you for joining us today. I'm Madi Bayat, Data Analyst with Health Logistics Thought Leadership Initiative, and the co-author of our first Shaping Supply Chain Policy Brief. Before getting into the findings, I want to take a few minutes to share how we got here, how a wide range of regional perspectives were brought together into a single evidence-based policy brief, because in many ways the process itself tells the story of localization. When we began, our goal wasn't just to produce another publication. We wanted to understand what localization actually looks like from within East Africa's humanitarian ecosystem, and to build that story through collective evidence rather than top-down interpretation. We started with a pre-workshop survey. It gave us a first layer of quantitative. That data helped us see where consensus already existed and where the tensions lay. Next came a series of in-depth interviews with 10 regional thought leaders from local NGOs, international NGOs, public-private networks, and coordination bodies. Those conversations moved us beyond numbers into lived experience, stories of limited influence in decision-making, under-resourced systems, and yet strong local innovation happening on the ground. Then in June 2025, we convened the Thought Leadership Workshop in Nairobi. For 2 days, participants who were the same 10 regional thought leaders interviewed worked through 6 thematic sessions, combining plenary dialogues and focused breakouts. The aim was co-creation, not defending position, but mapping shared priorities and realistic pathways for reform. By the end, we could see clear connections. Once the workshop ended, we brought all the material together using qualitative content analysis. We coded survey responses, interview notes, and workshop output for recurring patterns and divergences. Through this process, 3 major challenges stood out clearly: power asymmetries, internal capacity constraints, and rigid donor systems. Building on these, the synthesis led to 7 strategic priorities and a set of advocacy messages tailored to each stakeholder group, from donors and governments to international NGOs and local NGOs, outlining both short-term actions and long-term reforms needed to advance locally led humanitarian operations. And finally, those insights were distilled into a single comprehensive policy brief. Every claim was cross-checked against data and workshop evidence. The intent was not to present health logistics perspective, but to reflect the region's collective voice, shaped and validated by the people driving localization every day. Before I hand back, I want to take a moment to recognize the many people behind this brief. The insight came from regional thought leaders, and we are very thankful to all of them. A special thank you to Professor Dr. Mushtaba Salem, the lead of this initiative, who co-authored and guided the analytical direction, and to Kyoto Mahania, whose coordination held the entire thought leadership process together. I'm also thankful to Sean Rafter, our managing director, for his continued leadership and vision, and to Victoria Najono, our regional director in Nairobi, and her team for their support and engagement throughout this journey, and of course to our communication manager Dina Bukai for her genuine support for the publication's design. With that, I'll hand it back to Kyoto to guide us into the next part of today's discussion. Thank you.
Thank you all for the introduction. Thank you, Mahdi, for giving us an in-depth into how this process actually went together. Thank you, Victoria, for the inspiring words at the beginning. And of course, thank you to Al-Bashir for the opening anecdotes and stories about why localization is so important. And that's what we're going to get into here. My name is Kyoto Mahania, and I will be moderating a short panel for you just to go through some of the content and some of the insights about this policy brief itself. And to do that, we of course have no one other than 3 of thought leaders who represent a variety of organizations and backgrounds in the East African context. And so I invite Catherine, Al-Bashir, and Richard to join on camera. And we can do a quick introduction of each of you, if you'd like. Why don't we start with Al-Bashir, who you already heard from at the beginning of today's webinar.
Yes, thank you very much, Kato. I'm Al-Bashir Ibrahim. I'm the Executive Director of Organization for Sustainable Development Africa, a national and a local organization based in Kenya.
Thank you very much. Great to have you here with us today.
Thank
And Katrin, would you like to go next?
Yes, thank you so much. Good afternoon. This is Katrin Julian from Diakonie Katastrophenhilfe. I know the name is terribly to pronounce for non-German speakers. So the easier version is DKH or Diakonie, a humanitarian assistance organization. And I'm joining you from Nairobi, where I'm also based.
Great. Thank you, Katrin. And Richard.
Yes, hello everyone. Thank you, Keto. My name is Richard Nechi. I'm the Executive Director of Ecumenical Pharmaceutical Network, which is a faith-based network of working in 29 countries in Africa, supporting the FBO health system, especially on matters related to improvement of healthcare services, and relate also to humanitarian. Thanks and over.
Thank you very much. Having done the introduction, I'm going to stop sharing the screen for a moment while we discuss the actual content of this brief, and then you can see everyone's faces here. My first question, and we'll go now in the reverse order, starting with Richard here. We have these 7 priorities and 3 challenge areas within the policy brief, as well as various stakeholder messages and advocacy areas. Are there particular ones that have resonated with you? Ideas and concepts have really come to the forefront when you're looking through the policy brief and thinking back about the conversations that we've had?
Thank you. I would like even to start by really appreciating the process which really led to this outcome, this policy brief. And I would like also to commend the introduction done already by Al-Bashir, sharing on the different challenges on the ground. And one I think he raised, which resonates really with us, is almost the imbalanced power, as mentioned, between the international and local actors. This has been really one of the biggest challenge you'll find as organization based at the local level with huge experience. One of the things I think we undermine always in this balance between international and local actors is the fact that sometimes they ignore that local actors really, they understand the context. They really understand the context. They have the knowledge of what is needed. They know they are trusted in their communities. We work especially with religious leaders and many times even on health topics, when partners are engaging, they think they don't know anything on health matters, while they are very connected with congregants who comes to share their problems, personal problems, and sometimes we undermine this. So I think that imbalance is one of the key challenges I realized, which is affecting a lot. So in terms of priorities, so I would leave others also to share, but for me, the imbalance between international and local is really important. And you can also see it. We have seen partners sometimes coming to you. They've already designed their project, everything they have, and they come just to you and they say, you have a reach, you have a network, we want to work with you and to implement. And sometimes they ignore that we could also be very useful, and local actors could be even mostly useful in designing even and shaping the project or the plans to be implemented. I think this is really very, very critical. And on another note also, I think just in that imbalance, what we have also realized is we have seen even partners, in the structural system, we call what I sometimes call it interference in governance of local actors, because when you are in face of that, those limited capacities, sometimes these partners tend to even influence how you should organize your internal businesses because they don't really trust your capacities. In terms of priorities, quickly, I think it's the strategic priority related to positioning local actors is key for us, is really key. And especially in this context of funding reductions on what is happening especially in the health sector where we are working with USAID funding, which is reduced. I think it's time to rethink and ensure that we reposition local actors as part of the decision. We engage them from the starting. We tried one approach, which I'm proud to talk about it always. It was during COVID with all the challenges we had to access vaccines or the crisis which was around it. And we found that bringing local actors with their knowledge on the ground, with partners at the higher level, with the scientific knowledge, the compliance capacities, bringing them together, we call that strategy health and science, faith and science in conversation. Faith and science in conversation. This was very powerful to really bring, even at the higher level, they could not really realize that we have strong capabilities. We have leaders who can mobilize, who understand the situation at the ground, and who can bring the perspective to ensure that we deliver properly. And we could increase the uptake of COVID vaccines. We could also address additional issues related to the communities we are serving. Just when you bring those two perspectives together and engage them, and we learned that it's not right to engage these local actors when the crisis starts. It's good to engage them early enough as we are designing strategies. We are designing how to engage in crisis. We should really involve them from the beginning. In the health sector, we said when vaccines are, for example, being developed, is a time we can start talking about those vaccines so that when we'll come to address the Ebola crisis and so on, people will not feel we are bringing vaccines to kill them, but we are bringing vaccine to really solve the issues, and they can be engaged strongly. I will stop here, and yeah, happy to respond to any question.
Thank you, Richard. And especially mentioning questions. If any of you have questions at any point from the audience, feel free. There should be a Q&A button at the top of your screen to ask any questions, and we can weave them into the panel. If for some reason you can't find the Q&A button or it's not working, you can also send me an email and I will include the question as well as I monitor that. But Richard, you really touched on a lot of valuable points there, starting off with the imbalance of power, also coming down to where trust comes into play, how the positioning works, and then really at the end focusing on where the capacity to lead is, and also mixing in localization with preparedness and programmatic design. It seems to be weaving through all of these variety of themes. Now, Kathleen, I'll ask you the same question, but feel free to frame your answer with Richard's comments in mind as well. With these 7 priorities and challenge areas and advocacy messages, which one of these have resonated with you as well, coming from a slightly different context as Diakonie Katastrophenhilfe, a German NGO, but still very much ingrained in East African humanitarian action?
Yes, thank you so much. And I've realized I should have said maybe a bit more. Yes, we're a humanitarian aid organization. And since our beginning, that's now more than 70 years ago, we have been working through partnerships, mostly local partnerships, and we strive for equal partnerships. Knowing that this is sometimes a challenge, I mean, and that's the topic of our conversation today. And yeah, what I would like to pick is to look at it from the perspective of an international organization that we are supporting local actors in delivering timely and relevant and high quality humanitarian assistance. And maybe that will touch a bit on why the system change is being so slow, because it's just easy to talk about it and we keep on repeating the same messages over and over again. because in the end, it also means for organizations such as the organization I am representing, to let power go and to shift the power. And I would even go a bit further and saying not only to the local actors, but it should actually sit with those that are affected by disasters, affected by conflict, affected by natural disasters, whatever can cause humanitarian crisis, and put them in the driver's seat to decide about what they need and how they need it and when they need it and to which extent and for how long and so on and so on. So that requires for international organizations to also reflect on their role and adjust their role to it. Yeah. So I'm just coming from a workshop where we actually took some time, even so we have been working through local partnerships for many years. But it's still a constant reflection process for us to understand how are we accompanying our partner. Richard, you talked about positioning, and Al-Bashir, you also touched on that. So where is our position in the humanitarian system? And it's not about the implementing part there, but there are many complementary functions that we feel as an international organization we can contribute to the table, we can contribute to the partnerships. Yeah, and just to mention a few, and we try to summarize them under an intermediary function. Yeah. We can work as a fund, or we can support as a fundraising coach here, and support local organization in accessing funding. Yeah. But it can also be an interpreter or a gap bridger. Yeah. It can be a knowledge broker. Yeah. We can support on co-learning processes. Yeah. And now I would also like to pick one of the points that were mentioned in the policy paper, because we keep on talking about capacity strengthening of local actors. We need to empower local actors, and that always implies that local actors, have a lot of capacity gaps. Yeah, that might be the case, but also the internationals have their capacity gaps. Yeah, so that's why we think that referring to it as capacity sharing actually is a better fit. Yeah, because both sides need to learn and to see what they can contribute. Yeah. And facilitating those mutual learning processes may be a role that the international organizations in the humanitarian system can take up. Another one, convener and an ecosystem builder, where we think we can maybe add value, yeah, or as an advocate and an amplifier of local voices to make sure that they reach maybe those levels where important decisions are made. Maybe I'll stop here and give it back to you, Keto.
Thank you. Yeah, I know all of you could speak for a whole hour by yourselves on this topic, so it's gracious that you can keep the words concise. But there's a really good points there. I really appreciate the list and thinking of exactly what are the different ways that international local organizations and NGOs can all work together across the spectrum. Right, and reframing it, especially now you're mentioning capacity gaps. No, it's actually capacity sharing. Where can you fill each other's, where there is a struggle, where there is a difficulty to actually support in that. And Al-Bashir, I'll come to you last here with the same question. And again, feel free to build off of Richard and Katrin. But we've had these 7 priority areas. We have various challenge areas, and of course the advocacy messages in the policy brief. Are there particular ones that resonate with you, the same ones, or even different ones from Richard and Katrin?
Well, thank you very much, Help Logistics, for having us. I have 2 challenges and about 4 priorities that resonate with what we do, my experience, our expertise, and what we do in the Horn of Africa. I will try as much as possible to be brief. The first challenge that we always talk about since Grand Bargain in 2016 is power asymmetries or power imbalance, the issue of power imbalance. I'll give an example. If we talk about humanitarian country teams, be it in Somalia or any other Horn of Africa country, there is no equality, there is no equal representation. This coordination team, forum, is dominated by UN agencies and INGOs. It is very clear. And the local or national organizations that attend do not have decision-making powers. That is very critical to know. Then there is the issue of what we call reinforced power dynamics. We usually talk about capacity strengthening, capacity enhancement, capacity sharing, but this, much as it is good and it is well intentioned, sometimes it can reinforce power hierarchies by implicitly, assuming that international actors possess superior expertise to teach local actors. That is how it is now. So these efforts often focus on how to meet international donor requirements rather than empowering, local methodologies. We are not enhancing the capacity of local actors to help them grow, but it is done to tick boxes, donor requirements, and that really reinforces power dynamics. Then the other very critical one is the issue of risk aversion, perception that local actors are not reliable. They will misuse the fund that they are given. So we usually say, let's share risks. So that also gives us an issue, because most of the INGOs and the donors are risk averse, and we've been fighting for that space. The issue of local actors being treated as implementing partners clearly means we are not equal partners, so that also reinforces the issue of power, imbalance. So that is one big challenge. I know there are many issues, the issues of overheads. I don't want to dwell much into that. Then the second very important challenge that we are grappling with is the rigid donor, and compliance, donor systems, compliance system that exists. That is usually there is restrictive funding and compliance models that usually restrict the local actors. They were developed or created in such a way that it gives the INGOs and other international actors head start compared to local actors that are not mostly familiar with these models. Then the other one is bias towards international actors. Most donors, I'll give you an example. We competed with some INGOs in responding to a call by a donor, and what happened was our price was very competitive, about 150,000 USD less than what most of the competitors. That is the information we got later on. But an INGO was given that has quoted more than $150,000 more because of the perceived notion that they are technically more sound, they have more capacity, so that biasness is also a very big problem. Then perceptions of local organization having weak organizational systems or capacity is also another issue. We have local organizations whose portfolio is more than thrice some INGOs, but still some donors prefer to work with INGOs. So we are told they will be the intermediaries, you will receive funds through them, That's all, those are the two challenges. But for priorities, I will say there are 4 key priorities that resonate well with the experience I have and the experience my organization and the people we serve have. Transforming the funding models is one. We have a rigid short-term projects that are only used to firefight emergencies. 6 months project, 3 months, 5 months project. So such kind of model will not help us, realize the long-term or building the resilience of the affected population. So we need to have long-term or multi-year flexible direct funding to local actors. That will solve the issue. Then the issue of overheads will come in, or indirect cost recovery, which is very critical and which will significantly enhance the capacity of local actors, in the sense that our budgets are projectized, and most of our support staff have 8% of budget. So we do not have money to retain this staff. We do not have money to give them medical insurance. We do not have the money to give them gratuity. What happens? They will look for better jobs. They will go and work with INGOs. They will go and work with UN agencies. So that is, so we need to transform the funding model. Then number two, repositioning local actors as system leaders is very critical. We do not only see them as, implementers, but as involve them in strategic planning, involve them from the project design to the end. That clearly will clearly show that they are part of the program. They will own it, and the project will be very successful. And then we need to redefine the role of international actors as facilitators, but not gatekeepers. That's very critical, because the INGOs, yes, most of the INGOs have more technical, expertise than the local actors. Yes, why don't you guide us? Why don't you invest in strengthening the capacity of these local actors and just facilitate instead of implementing this project? And that will help, and that will help us in realizing the goals of localization of aid. And the issue of internal system, strengthening the internal system, is also one very significant priority area I would like to look at. We need to invest in the systems, in terms of most organizations are still using QuickBooks for their financial management. Others are using Excel sheets. So we need to invest in technically sound, robust ERP system, for instance, that digitizes, or that combines all these procurement, logistics, finance, human resource. Investing in that is very, very important, and long-term staffing strategies, where we invest in keeping the staff of the local actors. You will find a situation where they're always on the move. There is high staff turnover because we are not entitled to overheads. Very few donors give, and those who give less than 8% of overheads, which is a drop in the ocean. If we juxtapose that with the amount of money they receive from the donor. So that is also another. And then if we invest in strengthening the capacity of local organizations, local authorities, local communities, then they will lead with confidence, credibility, and operational autonomy. And so the bottom line is, we are not competing with international actors. We are here to complement each other. We are here to work with each other to alleviate the suffering of the affected population that we are serving. So what we are saying is, take a remote role. Basically, help us with technical guidance, facilitate, but allow us to implement. And let's not be just your implementers. Let's be equitable partners. Let's be equal partners. Let's transition from this transactional partnership system to an equitable, transformational kind of partnership that will build the confidence, the morale of the local organizations, the local communities. And then that means cost efficiency will be realized because investing in local actors, them implementing the project means they will do it at low cost compared to international agencies. Over to you, Kieto.
Thank you for that overview. Some really powerful statements in there that also reflect a lot of what your colleagues here said. We have transforming funding models as an important one, right? Longer term funding. Repositioning as system leaders. Richard mentioned this, that it's all about how you can have different people enter the different people be in the decision-making positions, coordinating. Katrin also mentioned that having some sort of way to have different people in the driver's seat, right? Redefining the role of international actors, which I think Katrin also mentioned, quite a few of those examples of different ways that different people can interact. And then internal system strengthening as well, a very strong area that is not always addressed when you think about localization, when you think about shifting power in that way. But as we head into the last section here of this webinar, I'd like everyone to think and look forward at how we move forward, right? Everyone, I think if you're in the localization conversation, if you've been here for 5 years, 10 years, 20 years, there's a lot of challenges and a lot of priorities. And so we start to wonder, how do you actually move forward and make an impact in the humanitarian sector with localization as the thread? And so within the policy brief, we have these advocacy messages for various stakeholder groups, right, where they're talking about humanitarian donors, development donors, international NGOs, UN agencies, local actors, governments. If you could each choose 1 or 2 or 3 things that you think could move forward to actually make these changes happen, right? We're talking concrete examples. We've already heard some of them, which is great. Or other ideas of how the relationship can develop. It would be great to hear those. And we'll try to keep each response under 5 minutes for the moment. And we can start with Richard again, this time since it's been a little while since we heard from you.
Thank you very much. I think I like all the advocacy messages which came out of these consultations. And one which really is aligned with already what we are doing and where we think, given the outcome we are seeing, we think it's very important, is on how do we strengthen local actors. It's one thing to really bring them at the level where they can understand that, understand all the gaps or the challenges or the perceived gaps which are making them be considered as only implementing partners, and understand how they can also take action to develop them. So one of the work we are doing, which is really clearly reflected on what is proposed, is being a network of actors in different countries. These partners are at different levels. So we think peer-to-peer learning is very important, and also maybe supporting consortium where we bring together strong local partners with weak ones, and make it as a platform for learning and sharing. We have seen this as a very powerful opportunity to bring partners really to move to the higher level. One of the things also we have designed, which I think should also maybe guide us, is what do we call those minimum standards which should be met by local actors? I think this should be very clear, because when they are clear, then we know how to bring them along the way in that process. So for me, peer-to-peer engagement, this is advocacy group 4, which talked about local actors, how they can move, developing standard operating procedures, those tools which are needed at the basic level. And we think if we bring in partnership actors, those who have already the tools, it's easy to build on those tools and move fast, then start reimagining how to develop those tools from scratch. So, and again, in the context already where funding is becoming challenging, I think creating those platforms for collaboration is very key, so that partners can move together. The other one, which also I think would make really sense in our perspective, is really donor should, humanitarian donors should really, the message which is focusing on them is for us very key, and we would like to walk around it and call all the participants here to consider joining our voices to walk around this. And we build coalition of advocates. Currently, our organization is part of many continental coalitions of advocate organizations where we raise the voice together, we discuss issues, we design the messaging, and we address it. So I think providing flexible funding, direct funding, multi-year funding is very key. We have examples of organization 45 years supporting at the continental level, at the local level, but after 45 years, they can't even sustain the operations for 1 month after the donor, the funding is stopped. It's not normal. After 45 years of really supporting and writing success stories at the local level, I think that's, and what, if you look at the history, what is missing is really supporting the overheads, giving long-term funding, and this is very key. And for us, we would like really to call everyone to walk around this key message, advocate message, which is well developed in this policy, to use it really to work along with other partners to address this. Yeah, thanks.
Great. Thank you for that, Richard. We'll have Al-Bashir will go next, and then Katrin will wrap us up. I just wanted to highlight, thank you for mentioning the flexible direct funding again. It's already the second time it's mentioned, so it must be a priority area. So it's another good one to recognize that repetition. Al-Bashir.
Thank you very much, Kieto. My brother Richard has already mentioned some very good points, but I will add a few. Reforming, the donor regulations or this rigid system is one very critical area which I think we need to invest in as a point of advocacy. We need to align, transform the rigid, difficult donor regulations that align it to local perspectives, or make it simpler without eroding or without undermining the quality of the regulations. So that is one very critical one for the donors. And then another one, we always blame INGOs, but as local actors, we also have to step up. One advocacy message for the local actors is to invest in. I know it is difficult, everything is projectized, yes, but we need to also invest in our institutions, in our system strengthening, strengthen our system so that we get the confidence of the donors, and then recruit competitively technical staff, good staff who can make the organization better is also another. Then the other very important one is investing in for the INGOs and donors in strengthening the capacity of the local actors, and also leave transition from intermediary and play the role of the facilitative role, and allow the local actors to play the role. Involve the local actors in from the design of the project. Instead of bringing them on when we are implementing, involve them. They should be privy to the budget. They should be privy to how the project is designed, because they understand the context better. So the priorities and the needs of the people. And so involving them from the program design stage to the end will add a lot of value. And I know that is for INGOs, donors, and I know the government also has a role to play. In a place like Somalia, I have an advocacy message for them. registration is very critical. We register with the federal government, we register with the state government, and it is renewed every year. It is not even renewed. You register afresh every year with the regional government and the state government, where you work. So they need to streamline this, put this into order, which is very critical. And if the government can do that, that will also ease in our work, and also it will make our work easier and to serve people, the affected people, better. Over to you.
Thank you, Katrin. You wanna wrap us up here with the final thoughts on the advocacy messages?
I think I'm terrible in wrapping up sessions. And as you have done a wonderful job, if you don't mind, I would pass this wrapping up part on to you. I'd just like to bring up a brief example, because I'm currently in a workshop together with 13 local partners across the region, so from Ethiopia to Madagascar and Mozambique. And we are discussing a governance structure and decision-making procedure in a consortium. And it's not an easy process. And honestly, of course, it would be just easier for us to sit together in a small team and just to define it. But we think that it will not bring any it will not bring good and sustainable results. And we feel like the process of really discussing it together and defining together on how we want to steer the consortium, how do we want to go through the planning process, how do we want to take decisions together, how do we want to approve, because it's like a crisis response plan, how do we want to approve projects that will contribute to the objectives of this regional plan. That I think is, or that we think is a much better way to achieve results that can also sustain, because then it's a program that is owned by all partners that are in it. And that to me is something different than someone designing it and writing it and taking the decision and then just giving it to local partners. Okay, this is the program, this is the project, this is the budget, so please take it and run with it. And Al-Bashir, you brought up so many good examples that clearly shows that, yeah, in most of the cases, it will not lead to good results. Yeah. So back to you, Kito, and now you can wrap it up.
Thank you. Well, I think you did a great job wrapping it up. We started the whole webinar today with Al-Bashir mentioning challenges to localization and not working closely with local actors. And here you have giving an example actively at a consortium where a program is being designed in collaboration, which I think is a really, really viable way to move this forward. I haven't seen any questions in the chat. I haven't seen any questions in my email, so I'll assume everything is perfectly clear and no one has any more thoughts whatsoever. But I really appreciate all of the ideas that you brought forward here. I mean, how different organizations work together and how different stakeholders work together is going to be a question moving forward. And I think Richard, Al-Bashir, and Katrin mentioned all of these together, whether you're talking about how local actors invest themselves in their own institutions and their own capacity, to how the relationship that international actors work with local actors and try to build relationships that are equitable and that are not just transactional, all the way up to how you register with your governments and how you work with donor systems at a whole. These are challenges that are going to be addressed at all levels within the humanitarian sector. And should not be taken lightly, although we're all trying to do our piece by piece. Now, you might be wondering where you can find more about what we've talked about here today, some of those thoughts and ideas that came up, or if you came from the supply chain side being associated with health logistics, you might be wondering, what does all of this mean for supply chains actually within the humanitarian sector? Have no fear, that's included in the policy brief as well, where each advocacy brief has highlighted supply chain implications. Now, if you want to read more about the policy brief, you can find it on this QR code on the left side. The policy brief can be found on that link. We are also running a global survey for all humanitarian actors to give insights. What does the future of the humanitarian supply chain and the humanitarian system actually look like? We'd be happy to get your insights as well for our survey. And if you want to have more questions, you want to hear more from us, you can reach out. You can reach out over LinkedIn, online, and we'll also be at a few events around the world in the next few months, speaking about localization, speaking about demand planning, and speaking about how we are going to reposition power in the future of this humanitarian system. Thank you, everybody, so much for joining. I hope you have a lovely rest of your week, and please be in touch if you have any other questions or comments. Thank you very much.